Welcome to Dynamica Labs, a new solution to a medical problem as old as mankind. Antibiotics are a necessity in everyday medical and dental procedures. They are vital for treating common infections. But over the last decade, we have seen a prevalence of superbugs, or highly evolved bacteria that are immune to antibiotics. The United Nations estimates that by 2050, superbugs could kill 10 million people each year. However, inventing new antibiotics is challenging. To make just one drug, researchers have to find 10,000 molecules and perform extensive tests on every molecule. Because of this, it takes over 9 years and $1 billion to make a new antibiotic. Our solution is to build an AI, or artificial intelligence, that can search through combinations faster. Our AI utilizes reinforcement learning, so that it learns from simulations and is not dependent on data sets to design molecules that have antiviral and antibacterial properties. Although there are pharmaceutical companies using AI, they are using AI to scan through databases on existing molecules to see what would be a good match. Our AI is different. We are using AI to find what the ideal target molecule would look like, and then we are using molecular dynamics to invent that molecule. However, by doing this, we are able to truly achieve a blue ocean, and we can make the drug in just 3 years with a mere budget of $20 million. In doing this, we are able to pursue value innovation. Our differentiation adds buyer value, while also providing cost savings that we can pass through to the buyer. When we look at what the pharmaceutical industry has been doing, they are doing a great job at delivery and branding. But we can add utility in other areas that they have been ignoring. By focusing on using AI to design and invent drugs faster and cheaper, we offer superior utility to the customer. Through the 4 actions framework and making an ERRC grid, we realized that it makes the most strategic sense to eliminate marketing, distribution, and branding, and instead to form a strategic partnership to white label our product. This way, we can focus efforts on our strongest skill sets. The strategy canvas also helped us realize that it would be a great idea to make our antibacterial drug also focused on treating tuberculosis. This also serves as a method for market penetration and for gaining market traction. By using dual targets of tuberculosis and antibiotic-resistant superbugs, we are able to capture non-customers of the industry. We began with Tier 1 non-customer tuberculosis patients. And as we grow and gain more traction, we want to reach Tier 3 non-customers, which are individuals affected by superbugs. The pharmaceutical industry has ignored them up until now because they were seen as rare diseases without cures. This map of the top pharmaceutical companies also shows us that no one is paying attention to or working on research and development for antibiotics at the moment. This means that we are not just in an untapped market, but we should not expect any competitors for the next decade. Through analysis with the price corridor of the mass, we have determined that although mid-level pricing is sustainable, we will begin with lower-level pricing in order to quickly gain traction. We are pricing this drug at $20 each, compared with the average brand name antibiotics at $221.75 each. Assuming we only capture 5% of our target market, we would have $22 million per year in revenue. But because the case for blue ocean is so strong, we should expect to quickly reach the global market for antimicrobial resistance. This is because this drug would have the highest survival rate for individuals who are infected with tuberculosis and superbugs. 8 years from now, we can expect to have $143 million per year in revenue, if the drug is successful. From there, we can expect to retain 90% of revenue per year. Since we have a profit margin of 70.4%, we have a net present value of $733 million in profit from a $20 million investment. Our vision is Dynamica Labs. With your help, we can cure the incurable and save thousands of lives each year. Thank you for your consideration.